Hello, this is Dr. Stanley Lang. Welcome to this video, and the topic is on how chronic stress causes disease, in particular thyroid disease. And I'd like to tell you a story about a patient that I saw back not too long ago that started seeing about a year and a half ago for how this was all happening in his life. And he was basically, like many of you are, under huge amounts of stress. And he was partly under this stress because he was being asked to do the impossible and he couldn't achieve it. And he's somebody that wants to do well, but was being kept from the goal by circumstances and asked to do what was literally impossible to do. And when you're in those circumstances, it's pretty hard to stay on an even keel. And he became more and more and more depressed to the point that he was suicidal when I saw him. And one of the things that I've discovered over the years is that the thyroid is often completely knocked off balance when this kind of chronic stress is going on. Now, how that happens, I'm not going to go into a lot of detail, except to say that there is a hormone that is called reverse T3 that is often not measured by most doctors because it's not part of their training. And so many specialists in the endocrine diseases don't believe it's a useful test. But I had some training in infertility that this was used a lot as a way to identify women who are under subtle amounts of significant stress. And so in this case, this person's usual thyroid tests were normal. The TSH, the free T4, the tests that most doctors order. If they order anything, they'll order a TSH, sometimes a free T4. And if they're both normal, you're assumed to be normal. Well, in his case, they were both normal. But like other patients that I've seen, his T3 level and his reverse T3 level, the balance of the two was completely off. It was off dramatically, probably in his case more than I've ever seen. And so you could teach this person how to do all sorts of stress reduction stuff, but he was in such despair that I didn't think he was going to do anything. So I did offer him one of the medical interventions that we have for this situation, which is to add back a little bit of T3 hormone. So most of the time when doctors prescribe thyroid hormone, it's T4. So I just gave him a small amount of T3, and within about 2 weeks, he was feeling a lot better. Within about a month, he was feeling a whole lot better as we continued to slowly increase the T3. And basically, he's stayed a whole lot better without doing anything different, without using any medicine to treat his depression or anything like that. Now, obviously, we also worked on his circumstances to try to pull back the things that were causing him stress within the realm of possibility. So we did a little bit of problem solving there. But the point is that this intervention with hormone in this way has a very powerful effect when it's done in the right way. But you just can't throw T3 at somebody when this ratio isn't off, because that won't help, or it'll make them hyperthyroid. So the goal is not to make somebody hyperthyroid, but at the same time, because the TSH and the free T4, the usual thyroid tests, are often normal, this condition is missed. It's because it's not even looked for. So what part of my sharing is to illustrate that stress can cause a profound effect on our hormones. And when the thyroid is thrown off like this, it has a ripple effect on a lot of other symptoms. Most people have profound fatigue in addition to this person's significant depression. So hope you found this instructive. And by the way, I have several patients with this condition who I have helped them to fix the thyroid imbalance without using any thyroid hormone. So it's possible to go to that kind of a solution also. But because in this case he was so symptomatic, I didn't feel like I could wait. So I wish you well, God bless, and have a great day.